Hello there, my name is Asmita, your IELTS mentor here at Vedantu, and today in our topic-wise breakdown, we're going to be breaking down the topic health and lifestyle. So if you're all set, let's get started. Before I do, if you haven't and if you're new to the channel, please fill out the student admission counseling form. Now, this form has a lot of information that you need to provide, and the reason for that is it's only meant for students who are seriously considering studying abroad. That means they've done their basic homework, they've spoken to their parents, they've figured out a budget, and they know what they want from their future. If you are one of those, then please do fill out this form so that you can make use of really good quality, expert, but free student admissions counseling that Vedantu is providing for you. Don't lose out on this opportunity. Sit down with your parents, take some time out, and make sure you're filling this out. You're going to be contacted by an expert who will put you in touch with the right people who can put you on the right path to success. All right, having said that, now let's get started. So in our topic-wise breakdown, what we generally do, for those of you who haven't seen those videos, is we look at some topics or some questions that you can expect from that topic in the writing section, then the speaking section. Then I give you some key vocabulary that you need to learn based on the topic, and then I give you some useful information that you need to know in order to be able to say something about this topic. We've already done this for crime and punishment, environment, education. This is now health and lifestyle, so make sure you're checking out the other videos so that you have a good topic-wise understanding of the kind of questions you can expect in the IELTS. Now, starting with writing task 2 topics. The reason why we're only discussing task 2 topics is because task 1 is going to be some form of data interpretation that's not topic specific. Now, for task 2, here are the kind of questions that you can see when it comes to health and lifestyle. Governments should spend more money on promoting healthy lifestyles than on treating diseases. Do you agree or disagree? Now, this is a debate that came about because of the increase in the number of lifestyle diseases. Now, a large chunk of the population is suffering not from virus-based diseases, bacteria-based diseases, communicable diseases, but lifestyle diseases. What the difference between these are? Well, you have no control over the kind of virus or bacteria or amoeba that can infect you, right? And that happens when, flu breaks out, something like COVID-19, the pandemic, and it's sort of beyond your control. Now, when it comes to a lifestyle disease, that is very much in your control. You have gotten that disease simply because your lifestyle supported it. For example, high blood pressure, diabetes. These diseases often happen because of the kind of practices we have. Not sleeping on time, taking too much stress, eating a lot of unhealthy food, high sugar, processed foods, lack of exercise. These are the reasons why you get these diseases. Now, because of the increase in lifestyle diseases, some scholars, economists, and other people have said that the tax burden on an average taxpayer has increased because taking care of this population has really driven up medical costs. Now, speaking of medical costs, I can tell you that my health insurance premium has increased drastically from last year because of, medical inflation. And the reason why medical inflation takes place, rising medical costs happen because the medical infrastructure is unable to keep up with the amount of people who are getting sick. So can you blame people with a bad lifestyle for increasing your tax burden or your expenses, or from putting can you blame them for putting pressure on the economy? These are things that you need to think about, you need to discuss, you need to read upon. Now, this is a question that's in a similar vein. It's asking, should government spend more money on promoting healthy lifestyles? What will that do? If you promote a healthy lifestyle, what will that do? That will lead to a decline in lifestyle-related disorders, right? Other than treating diseases. Now, obviously, we can always argue here that our government is not even spending as much as it should on a basic level on healthcare. So this discussion is a bit far-fetched, but you can take examples from all over the world, especially countries that have good healthcare medical facilities, which is free for all of its citizens. You can take those countries as case studies, and then you can sort of give your opinion on whether promoting healthy lifestyles should be a priority. Obviously, you have to treat diseases. People need medical care once they are sick, but should also focus be put on preventing people from falling sick in the first place. And this specifically applies to, what did I say, lifestyle diseases. So you should know what these lifestyle diseases are, and you should do your basic research on this. Next, some people believe individuals should be responsible for their own health, while others think governments should ensure citizens stay healthy. Discuss both views and give your opinions. Now, this is again, I've explained to you multiple times how there's always an overlap in topics. So here the overlap is clearly taking place between health and governance. Now we're going to do governance as a different topic, but when we do that, you will observe that almost every other question has another topic involved in it, because government overlaps with a lot of things. Now, should government policies focus on making sure people stay healthy, or is this something that should be personal? Now, obviously, the health, I feel, my personal opinion is education and health, both of these things should, are basic necessities, are fundamental, and governments should spend a good amount of money in making sure that both these needs are met. People have good nutritious food, access to good nutritious food, which comes under the realm of social security. You know how in America, if you're unemployed, you get a certain amount of money from the government for basic sustenance. A lot of other countries have a version of this. They get some sort of unemployment check. In India, we have a pension system for after you retire, but if you're unemployed, there is no such scheme. But so what usually happens is, if you're poor, if you're a daily wage worker, then your everyday work, whether or not you have food on your plate depends on your everyday work. And so if one day you're unable to work, maybe you're sick, you don't have any savings to fall back on, you might have to go hungry that day. So this is a huge crisis. I feel health, when it comes to diet, nutrition, and just basic awareness, sanitation, all of this comes under health, right? To keep your surroundings sanitary, to make sure you're getting enough nutrition, to make sure you're exercising, all of these things come under health. And how to avoid the spread of diseases, for example, diseases that are waterborne or foodborne, cholera, typhoid, stuff like that. India had a huge tuberculosis crisis, so you can read up on that. So just, should this be the government's responsibility? I feel 100% yes, it should be the government's responsibility. Vaccinating people, making them aware, teaching them basic hygiene practices, all of that, I feel is the government's responsibility. You can give your own opinion, you can discuss. Now, the thing with how the citizens should be taking care or should be responsible for their own health, I feel like that's a very privileged argument. You can expect people who are rich, who are privileged, who have good homes, who have access to great schools, parents who take care of them, even house help, etc., etc. Obviously, those people can take responsibility for their own health, and they do. You will notice that people who can afford it do not send their kids to government schools, do not go to government hospitals. They choose private schools, private hospitals. The reason for that is they trust those facilities more and they can afford it. So yes, with a certain amount of privilege, you should be responsible for your own health because you can afford it. So don't be a burden on public infrastructure, don't be a burden on the government. But people who cannot afford it, yes, it's the government's job to uplift them. This is my opinion on the matter. I've told you time and again, do not use my opinion as your opinion. Think about what I've said, try to agree, disagree with me, whatever, and do this with everything that you read. Apply your own critical thinking skills and then come up with your own opinion. Next, nowadays children are less physically active than in the past. What are the reasons for this? What measures can be taken? What are the reasons for this? iPad, laptops, phones, YouTube, videos, Instagram, right? So a lot of parents now just kind of, every time they are overburdened, overstimulated, and they don't know what to do, their child's throwing a tantrum, the easiest fix is to give them something that they can watch for 2 hours or 3 hours, and then they're just entirely distracted and don't bother you. Now, obviously, parents, before the advent of the internet and technology that we have today, did not have this luxury. They had to put up with their children or find more creative distractions for them. I think for us, the distraction was just, do arts and crafts, go play something, play a sport, stuff like that. So now I think a lot of parents did fall back on technology and the internet without realizing the negative consequences of this, because of which, yes, children are less physically active. All they want to do is be on their phones, watch something. And because of this, we have this sort of an obesity crisis, and we have lifestyle diseases now developing at an earlier age. I don't remember as a child staying at home past like 4 p.m. Come home from school, eat something, and then you're out of the house. 3-4 hours, we were just all playing, running, coming up with new games, playing badminton, tennis, whatever, doing some sort of physical activity. So I feel like that culture, from anecdotal evidence, yes, has gone down, has declined. And because also I feel there are no societies as such anymore, and I don't know if the world has gotten more unsafe. I am not sure what the stats are on those. But people have generally become more aware of the dangers of letting their kids just play outside. And constant supervision is required. And not everybody can afford that time. The economy is kind of bad. And both parents generally have to work to make a household comfortable. So those could be possible reasons why children are not able to go and play outside. You can come up with your own evidence or your own anecdotes, your own observations, and answer this question. Okay. The increasing popularity of fast food is causing serious problems to people's health. To what extent do you agree? I agree 100%. Fast food is bad, it's awful, it tastes amazing, we crave it, we eat it, we feel guilty. But yes, it has led to a huge crisis. Now, I wouldn't say this is happening too much in a country like India, because we still have the culture of cooking at home. That's still happening. But if you look at first world countries, almost all their meals are processed food. A lot of it is fast food. You just on the go to a drive-through, grab something to eat, and that has had a very bad impact on their health. So yes, increasing popularity of fast food is causing serious problems. You can give your own reasons why you feel so. Next, some people think doctors should be responsible for improving people's health, while others say individuals should take responsibility. Now, yes, a basic responsibility of a doctor is to treat a patient, but what beyond that? Okay, that's what the question is trying to answer. Very similar to the government versus individual question. Now, here you're just substituting government with doctors, and you can give your own opinion on this. Alright, so these are the kind of writing task 2 topics you can expect. Now, coming to speaking part 1 is your general introduction, your general yappity yap about your own life. Here the questions are, do you prefer to eat at home or in restaurants? Why? The reason why this is in this topic is because if you are the kind who prefers to eat at home, then it's generally because of one of two things: health or cost, right? You think it's too expensive to eat in restaurants, or you think it's too unhealthy to regularly eat in restaurants. That's why this has come under the health and lifestyle, and this also pertains to lifestyle quite a bit. Some people have the kind of a lifestyle where they eat out a lot. How often do you exercise? Again, lifestyle, health related question, very easy to answer. Do you think you have a healthy lifestyle? You can give your honest answer in this. No one's going to judge you if you do not have a healthy lifestyle. That's perfectly fine. It just depends. The only thing you're going to be judged on is how you are answering. Are you using good sentences, good vocabulary? Doesn't matter if you are a lazy sloth, couch potato. It's okay. You can be honest. That's not going to work against you. Okay? Next, for speaking part 2, the cue card or the long turn, what can you expect? Describe a healthy habit you have. You should say what it is, how you develop this habit, why it is important, and explain how it benefits your lifestyle. So here, clearly, this question itself specifies how it benefits your lifestyle. That's why it's under the health and lifestyle subtopic. Healthy habit, a healthy habit. Now here, you should broaden your horizon a little bit when you're thinking about health. Don't just think about diet and exercise. You can also think about mental health. That's a huge part of health and lifestyle as well. So any healthy habit that you have developed that keeps you positive, that keeps you motivated, that generally helps you deal with anxiety or stress. That's also something that you can talk about over here. Next kind of a question, describe a time when you made a lifestyle change to improve your health. Similar question, just differently worded, and you can expect that even when it comes here, you can expect this type of a question or this type of question coming in multiple ways, asked in many different ways, all right, but the essence is the same. Finally, we have our speaking part 3, the critical thinking part of the IELTS speaking test. Do you think young people today are healthier than older generations? Why or why not? Again, very debatable, very subjective, no right or wrong answer here. As long as you're able to justify your stance, it's completely fine. You do not need to know the stats here. You do not have to be factually correct. You can mention that from my own observation, when I compare myself or my siblings to our grandparents, you can give such anecdotal observations, and that also suffices as an answer for this question. You don't have to go check the international health data, whichever body, WHO data. You don't have to do that. You don't have to be factually correct in the IELTS. You just have to be able to justify your opinion really well. Second question, should schools take more responsibility for teaching students about healthy lifestyles? I think so. You can give your opinion. How has technology changed the way people approach fitness and health? It has changed massively. It's much easier to keep track, be it of your calories, of your steps, your pulse, etc., etc. So definitely has had a huge impact. You can talk about all of those things. So that brings us to the end of discussing the kind of questions you can expect. Now, in order to answer these questions properly, in order to answer these questions properly, you need to have appropriate vocabulary, lexical resources, 25% of your score for both writing and speaking. That's why you need to have good vocabulary related to this topic here, which is what I'm going to be giving you next. So you can go through the meanings of these different words. I will read them out for you so you know their pronunciation. Sedentary lifestyle, balanced diet, obesity epidemic, preventive measures, work-life balance, nutritious food, chronic illness, mental well-being, fast food culture, stress management, health conscious, physical activity, and you can add some words that I've told you otherwise. Lifestyle diseases. A lot of people now talk about some neurotransmitters, serotonin, dopamine, right? A lot of there's too much of a dopamine hit that we're getting out of social media that can be bad for our brains, that makes us lose our ability to focus. You can use those buzzwords as well. Lifestyle diseases, the term that I gave you. So add these. Cortisol. When people talk about stress these days, they talk about the stress hormone, which is cortisol. This builds up cortisol in your body, or this increases cortisol production in the body. So you can use these terms if you're familiar with them. Add them to your list of health and lifestyle related vocabulary. Now, what are some things that you need to know about in order to answer the questions adequately? Preventive healthcare, which is usually good for lifestyle diseases. So here, taking care of your diet, exercise, and getting regular checkups is cheaper and more effective than treatment. Obviously, before things get too bad, you can take care of it. A stitch in time saves 9. Next, lifestyle diseases. Again, I've already told you about this, so you can take a look. You know, heart disease, the increased risk of heart disease is a topic that's generally discussed. It's in the news a lot. Mental health is also a part of health, so don't think health means physical health. Mental health is also important, and stress management plays a big role. Governments run public health campaigns like anti-smoking ads, fitness initiatives. Technology influences lifestyle, fitness apps, online workouts, health trackers. So you should know about these different things in order to adequately answer all of your questions. And that brings us to the end of today's topic-wise breakdown. I hope you found that helpful. If you did, then please do subscribe to the channel and share it with your friends. Why do you want the benefits alone? Sharing is caring. So make sure you tell everybody else who can benefit from this to subscribe to the channel, like the videos, share them, leave your comments, and follow us on Telegram so you don't miss out on updates. I will see you very soon. Take care. Bye-bye.